If you don't see them posted yet, just know that HCD is working on getting them uploaded to the website. A copy of the slide deck and recording will also be emailed to you by your grant administrator. Next slide, please. And now to cover how to ask a question. All questions must be submitted in the chat box. When submitting your question, please type your organization and question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers if possible throughout the presentation. Because today's topic has a lot of content, any questions related to pit count will be answered via email when we send out the Q&A transcript. All questions and answers entered into the chat box will be recorded as part of public record, and we will be emailing out a full transcript of the Q&A. Next slide, please. Today's office hours agenda includes the following: ESG updates, ESG-CV updates, upcoming webinar trainings, using ESG funding for point and time count, and Q&A. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESG-CV grant administrators, and other consultants who are able to answer questions during the Q&A session. Next slide, please.
Taylor, I think you skipped the pit. If you can go back one more slide.
Thank you. HUD is hosting point and time count office hours on Wednesday, January 12th from 10:30 to 12 p.m. Pacific time. This pit count office hour session will provide guidance on the following topics: using emergency solution grants and ESG CARES Act funding to pay for pit count activities, guidance on counting structures when conducting the unsheltered pit count, an overview of pit count resources updated with the 2022 Homeless Management Information System, data standards, and the end of the call will be reserved to answer any questions you have about the 2022 pit count. And now I will hand it over to Connie for our ESG updates.
Helena, there's a couple other slides we have to get through before. Connie, can you go to the racial equity? There we go. Thanks.
Oh, there we go. Sorry. So for the racial equity and coordinated entry system training, California Housing and Community Development is announcing a training opportunity on January 19th, 2022, titled Racial Equity and Coordinated Entry System. This training is being offered throughout the Emergency Solution Grant, Coronavirus Relief Consulting and Staffing Services, ICF contract. All California COCs are encouraged to attend this training session on racial equity and coordinated entry system. Attached, you can find the training description. Next slide, please. Okay, and now I will hand it over to Connie for ESG updates.
Thank you. Good morning, everybody. ESG updates, 2021 ESG applications. We are still reviewing. We got a lot of applications in, and we're working as fast as we can. We want to make sure we do a thorough review. We anticipate making award announcements. It's probably going to be towards the end of this month before I'll be able to make any kind of award announcement. But we are working, and we are getting through the application review. For those that have 2019 contracts, and if you have not submitted your final request for funds, I know that your grant management reps have been reaching out to everybody. Please submit those final requests for funds along with a certificate of completion so we can get the 2019 closed out. If you're not sure what to do or so forth, reach out to your rep, reach out to me, send an email through the NELFA inbox, but those must come in within the next couple of days so we can close down 2019. 2020 annual contracts. We have, well, first of all, I want to just remind everybody, we're, for those with 2020 contracts, everyone is contractually obligated to submit at least one request for funds to us every quarter, at least one. We have some grantees that like to submit just one for the entire contract, and that can't continue. We will start reaching out, calling you if we have not received a request for funds for you. Also, I want to remind those, you are also contractually obligated to submit your first request for funds within 120 days of the date your contract was executed. So if your 2020 contract was executed with us on July 1st of 2021, you have, and we want one before then, but you have 120 days to get your first request for funds into us. If you have not submitted one at this point, then you are out of compliance and we will be calling you. So we need those RFFs to come in on a regular basis. And again, if you're not sure, you have any questions, please reach out to your rep. Do not hold on to your RFFs and submit at the very end of the contract period. Next slide, please. A reminder that we're not in the office and we have not been for a long time. Please be sure you're emailing any document that you want to get to us or to your rep, whether it's all your RFFs, all your detailed expense reports. Any document, please email it. Do not send it through the mail. We've been talking for a little bit about mini monitoring. I want to make sure everybody just remembers and is not caught off guard. When your rep sends you a request, after you've sent them a request for funds, they're going to ask you for some backup documents for 2 expenses on every RFF and detailed expense report. So for example, if you send in RFF 1 today for your 2020 contract, and you had some rapid rehousing on there and some shelter and some HMIS, they're going to pick 2 expenses off your detailed expense report. And then under each of those 2 items off your DER, they're going to ask you for some backup documents. So that if, for example, if you submitted expenses for rapid rehousing, for some rental assistance that month, under that RFF rather, they may come and ask you, and they will take a snip out of that DER and put it into an email, so it's very clear what item they're asking you. They may ask you for a copy of the lease between the client and the landlord. They may ask you for a copy of the check to the landlord. They may ask you for a copy of the intake form, so we can confirm that if you're billing us under rapid rehousing, that client actually qualified and met the definition of a client that would come in under rapid rehousing. So just be aware that you will start seeing those requests. This is part of our monitoring. It will be ongoing and part of the workflow going forward. We call it mini monitoring. There will be communication with you if we find that maybe something isn't quite right, if maybe the leases aren't signed. If we have any questions, your rep will be working with you. We will be beginning, and we will have a webinar on this, but we will also start doing a yearly monitoring, which should start probably in sometime in February, and more to come on that. So next slide. I wanted to just let you know we do have a couple new team members on the ESG team. And also just to remind you who is a part of this ESG annual team: Diana Prado, Giovanni Martinez, Sarah Theobald, Tuesday Cool, and Sam Liu started with us on Monday, and Anthony Cepeda. We have also realigned a lot of our fields, a lot of these, so I'm sure probably have already received or will be receiving in the next day or two an introduction. If you now have a new rep, they will be introducing themselves to you and giving you their contact information for your 2020 contracts. If you have any questions, you're not sure who to send your RFFs to, then again, you can always reach out to your prior rep. You can reach out to me, but you will be getting some intro emails and ask that you work with them. And I think you'll find everybody is just really eager to work and be good partners with you. So if you have any questions, again, that ESG NOFA inbox is always a good place also to send any questions. And that is all I have for today.
Thank you so much, Connie. Next slide, please. Now I have just a few ESG-CV updates and reminders. As a reminder, the deadline to submit copies of your executed contracts to your grant administrator was December 31st, 2021. Please submit copies of your contracts to your GA as soon as possible if you have not done so yet. Reminder to continue working on submitting requests for funds on a monthly basis if possible. And if you need any assistance with categorizing line items from subrecipient invoices, please reach out to your grant administrator for assistance. And remember that you can provide the RFF template to your subrecipients to complete it if that will help with categorizing their invoices. Next slide, please. Oh. And now I'm going to hand it over to Chris, who will discuss some changes to the office hours format. And following that will be a presentation by Ashley Kerr on the pit count.
Great. Thanks, Helena. And thanks everyone for joining us this morning. As Helena said, my name is Chris Pitcher. I'm the Training and Technical Assistance Lead for the ICF contract for managing ESG and ESG-CV. We are making a soft launch today and moving more directly next week towards a new type of office hours. In fact, it's going to be basically two different things. It's going to be the office hours that you traditionally know, plus a little bit of our training and technical assistance team coming and giving you specific guidance on specific topics week to week. We're going to change from webinar to Zoom meeting, which means it'll allow us more opportunity to interact, to ask questions verbally, to see each other once the presentations are done, and having more of a peer-to-peer conversation than we have in the past. We are going to start that today, where we're going to talk about the point-in-time count and specifically how we can increase some of our vaccine efforts around the point-in-time count efforts. We'll hand that off to Ashley next. So do note there's a new registration link. So the one you've been using to get into these office hours is going to change starting next week when we take on our next session, which is leveraging and braiding funds. So again, next week we'll have a little bit of office hours like we just did this morning, and then the training and technical assistance team will do a short presentation, and then it'll be much more open through the meeting, through the Zoom meeting format for us to have more of a conversation. So we're calling our part of the series a brown bag, where you can come and just kind of talk to us over your lunch, recognizing that it is morning time at this time in California. So come and talk to us over your brunch bag, I suppose. You see we have nothing going the 19th because we have another training that was already promoted during the session. That's racial equity and coordinated entry system that we're doing on the 19th. We'll pick back up on the 26th. And round out January with our ESG written standards and best practices. With that, I'm going to give over to our training and technical assistance team, Ashley Kerr, to talk us through point in time and vaccine efforts. Ashley?
Thanks so much, Chris. Before I get started and introduce myself, there is a question around the monitoring. And I thought that would be a really good question to answer prior to me going in and talking about vaccination efforts. So Connie, would you look at the chat? It's a real question around the mini monitoring and a yearly monitoring. Deidre asked a question, and I just wanted to put that out there before I started.
Actually, we do a Q&A at the end with all of the questions that come in. So
never mind. And I believe you all told me that, and I have promptly forgotten about it. So sorry about it. And we will get back to the monitoring question at the end of the session. So my name is Ashley Kerr. I am working with ICF's training and technical assistance team. Really happy to be here today and talk about vaccines. I've been doing vaccine work for about a year now. with the COVID-19 team at the Department of Housing and Urban Development, and have had the, I think, fortunate opportunity to go and actually engage in some vaccine events in both New Orleans and in more rural parts of Louisiana. Next slide, please. And next slide. All right, so I think everybody probably knows right now that there is an annual point in time count every year. It happens in January. It is the last week of January, and that is organized and planned out locally. You all have an opportunity to use your ESG-CV funds not only to engage in point in time or PIT count activities, but also to increase vaccination rates among people who are experiencing unsheltered homelessness. Next slide, please. So there are a couple of different ways that you can think about offering vaccinations. You can think about them as part of this sort of larger community event, which is really an effort to draw people in to a place to get counted during that January date. Or you could think about it as a much more mobile approach in which you are taking the vaccine out to people. And so again, this is something that we're going to talk about. There are low rates of vaccination among people experiencing homelessness. We are seeing that really in folks that are experiencing unsheltered homelessness. We know that there is a lot of misinformation out there. So this is really an opportunity to think about what kind of resources you can pull together, not only to educate about vaccinations, but then to offer those vaccinations on site. People can be, if they're eligible for booster shots, those can also be available at those events. And you can offer incentives for people who want to get vaccinated, which is awesome. And I will say, in some circumstances, is the sort of the item that pushes people over to the yes. So people who are a little ambivalent, oftentimes if you can offer that incentive, it moves that ambivalency over to a yes and they get vaccinated. Next slide, please. Okay, there are a number of eligible costs related that are all eligible under ESG-CV. And I'm going to talk through all of the ones on the left side. I will just sort of leave that piece on the right of how you can actually bill it, like which line item and which activity you're billing this to. But vaccine ambassadors, if you are not already using these folks, these are trusted community members. They can be elders, they can be faith partners, they can be people with lived experience. It can be staff members, right? So who do people trust? And especially if you're working with folks who are unsheltered, thinking about your street outreach team. But those vaccine ambassadors are folks that are there to not only educate about the vaccine, but to answer questions to help move that ambivalence feeling from a maybe to a yes, and really try to address those concerns. So these folks are eligible to be paid for under ESG-CV, and they are great assets to any sort of vaccination event or vaccination opportunity that you're going to offer in your community. You can also transport people to vaccination events. That is an eligible activity. And, depending on whether you need to, if that vaccination event is happening offsite, you can absolutely transport people and take them to where they feel most comfortable getting vaccinated. You also have the opportunity, of course, to have those vaccinations on site when you are talking with people. So there's lots of different ways that you can do it. PPE, right? So personal protective equipment, that is all eligible for vaccination events. We're talking gloves, we're talking masks, we're talking eye protection, but anything that hand sanitizers, wipes, things like that, anything that you all need, that's cleaning supplies, but all those things that you need for that vaccination event is eligible under ESG-CV. Let's talk about staff training. Not only do folks need to really understand what happens in the vaccination itself, not super detailed, that's where your vaccine ambassadors or your medical professionals can really help here, but just training staff on, hey, this is what's happening for the vaccination event. Here are the different strategies that we're going to use to try to vaccinate folks who are experiencing unsheltered homelessness, really help move folks to those vaccine ambassadors if they have questions. Vaccine incentives, I know, is a huge conversation topic. You can offer up to $50 per dose. We're going to talk about that in a couple of minutes, but $50 per dose, that could be ultimately $150, right? If you get the mRNA, so that's a 2-dose regimen, and then you get a booster dose 6 months later, or 5 months later, depending on what CDC is telling us these days. You can also offer emergency health services. And what I want to say here is one of the things that we've noticed when we have actually gone out and offered vaccinations is that we have offered them in conjunction or next to a variety of other opportunities. So we offer tetanus shots. You can offer flu shots. You can get those at the exact same time you get the vaccine. There may be a real opportunity here for if you have street medicine teams or other licensed medical professionals that can address first aid, that can address, do blood pressure screenings or any of the things that your community needs, the community that is experiencing unsheltered homelessness. This is a great opportunity to put those two efforts together and really try to offer something that can really incentivize folks to come not only get counted, but to get their vaccination. And then I will also just say hotel motel costs are eligible. So there are many of us who have gotten vaccinated and had side effects. Some of those side effects are more moderate than others. Fever, chills, just generally feeling fatigued and not feeling that great. So you can use ESG-CV funds to put people in hotels and motels for a night or two to recover from those side effects. Next slide, please. Okay, I mentioned the $50 per dose. Cash is okay. We want to say oftentimes we're going to see that in the form of gift cards. If you are offering gift cards, make sure those are unrestricted gift cards so that you are not restricting anybody to shop in a particular store. So a Visa gift card, an American Express gift card are those types of gift cards that can be used in many places. Please make sure if you are using one of those gift cards that has that, I want to say like not a user fee, but like the activation fee, that's the word. You need to pay for that ahead of time so that people can just get that card and go use it whenever they need it. So make sure that you're able to do that and that you plan accordingly for that. Of course, you do need to determine if there are other vaccine incentives in the community. Sometimes that's happening, sometimes it's not, but just have some documentation in your files that there were not incentives being offered to the particular population that you are serving and that you want to offer vaccine incentives. Of course, those folks need to be eligible for ESG-CV funds. That is likely who you are going to be running into when you are working with unsheltered folks. And then, of course, you need to document that the participant actually received the vaccine. So the gift card or the cash comes actually post-vaccine. And what I will say is there's usually that 15-minute period of people getting observed after they get their shot. That is a great opportunity not only to do this pit count and to talk to folks, maybe engage in some of that first aid, but also to introduce housing conversations, right? What can we do to get you engaged in services? What can we do to get you permanently housed? That is a really good opportunity while you have people there waiting to have those conversations. So think about really maximizing your time with the folks that you're talking with. Next slide, please. Okay, best practices. We mentioned, right, using ESG-CV funds to pay for any number of these activities, and there are a lot that you can do, and I went over them earlier in this presentation. The other thing I just want to say, right, is that you can transport people absolutely to vaccine events, and really, this is a conversation that you have with each individual. This is really an individualized approach in which you want to say, where do you feel most comfortable getting your vaccine? We have it here, right? That's the best practice, is to bring it to people, because we know that when it is super convenient, it is much easier to say yes. But there may be folks who say, I only want to get this kind of vaccine, and I only want to get it at X store, right? So I'll just use an example. Like I was talking to a woman in New Orleans and we had the Moderna and she's like, I'm only getting Pfizer. And what I really wanted to do was to say, okay, you know what? I'm going to walk you to the Walgreens right now and we're going to get that Pfizer vaccine. So think about ways that can be really individualized for the person and what makes that individual most comfortable to get vaccinated. We have a lot of information out there, and I will put it in the chat in a few minutes around vaccine messaging. You also have a lot of stuff in California around vaccine messaging. So there are a lot of tools that your street outreach teams and that your volunteers can use to really think about how to increase vaccination rates. And that not only are these messages that work, but also who is delivering those messages. So that's where we really get to those vaccine ambassadors, those medical professionals, folks that people trust. And that really depends on the person. You know, if you are working with street outreach teams, they know the folks who are living unsheltered the best. Talk to them. They are oftentimes the trusted individuals, but there may be medical professionals, street medicine teams, other folks that can provide the information that folks need to get comfortable enough to get vaccinated. And then, of course, we're just going to keep saying this over and over again, offer the incentive. I will tell you, I had many conversations when I was on the ground where I said, hey, we are offering vaccines. We've got tetanus. We've got the COVID-19 vaccine. No, thanks. I have a $50 gift card. Absolutely. And it doesn't happen for everybody, but it happens enough that it is absolutely worth your while to offer incentives. And that is one way to get it done. So I really encourage everybody to think about utilizing all of the different eligible activities under your ESG-CV funds to be able to increase vaccination rates. Next slide, please. Okay, I mentioned sort of both of these things. And again, just if you are having any types of questions around your ESG-CV funds, how you can use them, contact your grant administrators, contact the ICF-TA team, and we can help you work through all the different questions that you may have related to your ESG-CV funds. But we are really trying to think about how we can increase vaccination rates for everybody. And that includes boosters, right? So how can we get people fully vaccinated, and let us know what kind of questions that you have, or if there are any sort of, major, I think, sort of hesitation comments or questions you're getting from folks, we can offer some answers and we can offer some ways to approach that conversation so it feels as if you can really move folks from a space of disinterest or even ambivalence to a yes. Next slide, please. Okay, again, you all are there for the pit count, and it's mandated, it's required, you have to do it. So we want to think about vaccinations as an add-on, right? So this is really a no pressure, a low-key way to try and bring folks to vaccinations or bring the vaccinations to folks. But the pit account is, of course, the first thing that you're working on. The other thing I just want to point out is, and this is really where your street outreach teams and your case managers know the population better than we do, right? And better than I do, because I'm not out there with y'all. So think about when vaccination efforts would be most effective. That may mean in the evenings, that may mean at night. It may mean during the day, it may mean actually a combination of all of those things. But talk to folks about what would work best for them, and then make sure that you are accommodating that to the best extent that you can. Knowing that people who are living outside may not be available during the day because they're sleeping or resting because they are up in the evenings. Just think about that as you think about scheduling not only the count, but the vaccination efforts as well. And again, this is an individualized approach. It is not what I say is going to work for one community is not necessarily going to work for the other one, but you just need to rely on the expertise that you have in your community about who you are serving and how you can most and serve them best. So thanks. Next slide, please. Okay, again, we talked about the eligible costs. This is really thinking about whether you bill it to outreach or you bill it to administration. And so this slide just goes over it. And I know the slide deck's going to go out to all of you, but thinking about, right, PPE for volunteers and staff, it is, you think about it as admin if you're billing it to the pit count only. If you are conducting street outreach activities, and thinking about entering data into HMIS and other activities related to street outreach, then you can bill that to street outreach. And again, this just tells you, bill it to street outreach, bill it to admin. If you have any questions, talk to your GA, and your GA can help you answer those questions. Next slide. This again just continually goes through that, right? Do you bill the street outreach or do you bill it to admin? And again, thinking about, right, basic needs like hygiene, socks, hand warmers, that all goes to street outreach. Same with staff salaries and hazard pay, because they are folks are conducting the pit count and providing general outreach and engagement. That all goes to street outreach. But then just general planning activities, right? And how you, all of that organization ahead of time goes to admin. Okay, next slide. A couple of things that ESG-CV cannot pay for, right, is food and beverages for volunteers and gift cards for volunteers. So again, thinking about how that ESG-CV, what's eligible and what isn't eligible, these are two items that are not eligible for the volunteers that you are working with. Okay, I think that might be the last slide, but I'm not entirely positive because I had my colleague pop up. So I think I'm going to turn it back over to y'all.
Thank you so much, Ashley. So just as a reminder, these are the ESG and technical assistance resources and COVID response resources for ESG. Next slide, please.
And I'll just jump in on this one. So we have a number of resources out there that help with not only infection control measures, but what the existing CDC and NHC, HC stands for National Healthcare for the Homeless Council. So both of those entities have a lot of guidance out there. And they are, as you know, CDC is changing refining their guidance on feels like an almost daily basis with Omicron. So, always go back to the source and to get your most recent and most updated information.
Next slide, please. Okay, so we're now going to move into our Q&A session. I'm going to start with the questions that have been added during our presentation. As a reminder, you may continue to add questions to the chat box throughout the duration of our time together. So let's see, the first question was from Deirdre. And the question was, confirming that you just described two monitorings, a mini monitoring and a yearly monitoring. Did you say that both will begin in February? And does this mean that we will get notification in January for the type of monitoring and testing that will be conducted beginning in February?
So I will take that. This is Connie. No, they're two different things. Mini monitoring has started already. So if you have a 2020 contract with us, you will start getting requests from your grant rep. When you submit an RFF, they will turn around and request a couple expenses and backup documentation from every RFF. So if you have a 2020 annual ESG contract with us, your rep will start asking you for some backup document for just a couple expense items on that RFF. And that began back in November. The yearly monitoring, we will, that has not rolled out yet. That's when I mentioned probably February. So two separate things. Mini monitoring is something we look at every RFF and ask for some backup documents. The yearly monitoring will be different, and that has not started yet.
Thank you, Connie. The next question is from Emily. She asked, will the new office hours format be recorded and available for viewing at a later time? 1/26/22 is also the pit count, and we will not be able to attend. The new office hours format will be recorded except for the conversation portion, and we will also share slides from each presentation. The next question is from Shannon, who asked, can we use ESG funds for PIT count even if we did not include it in our original application or budget? Heather, can you answer this question, please?
Can you repeat it?
Sure. Can we use ESG funds for PIT count even if we did not include it in our original budget or application?
If you have a street outreach project, it is an eligible activity under a street outreach project. You would not have had to indicate that you are using it specifically for PIT count, but it's an activity associated with street outreach project.
Thank you, Heather. The next question is from Ben, who asked, next week's office hours also overlap with the PIT count office hours put on by HUD. So we will be recording the HCD office hours next week, except for the community discussion portion, and you can review those materials at a later date. The next question is from Shannon, who asked, can we do these incentive cards with ESG even if not in our original budget application? I think we just answered this question. The next question is from Debbie, who asked, when will we be able to access this PowerPoint and recording? The answer to that question is we will email the recordings and materials to all attendees, hopefully by the end of this week. And they will also be posted on HCD's website, which currently has past recordings up to November 30th, 2021. Shannon asked, do they need to be entered into HMIS? I think Shannon was referring to the PIT count for HMIS. Ashley, or can someone answer Shannon's question?
I'm wondering if Shannon can can provide a little bit more detail in the chat. So if she is talking about are folks getting entered if they receive like an incentive, then I'm going to ask Chris to weigh in, but basically with street outreach, you are trying to put people into HMIS to the extent that you can get the information.
Yeah, I think my interpretation of Shannon's question is, if we're doing vaccine incentives, do we need to enter everyone that receives a vaccine incentive into HMIS? And the answer is not necessarily, but as a street outreach project, we should be trying to engage and all folks that are in an unsheltered situation. But there's no one-to-one correlation between I got a vaccine, I need to be in HMIS. It's more about engaging folks in an unsheltered situation and making sure those folks are in HMIS.
Thanks, Chris. And there's also another question from Shannon. Are vaccine incentives for staff and volunteers allowable either under vaccine incentives or volunteer incentives and or hazard pay? Being able to provide this, oh, sorry.
No, go ahead, please.
Being able to provide this incentive to the staff working with people experiencing homelessness could increase our staff volunteer vaccination rate and motivate more staff to recommend the vaccine to the people they work with.
So the vaccines are eligible for people experiencing homelessness. The vaccine incentives, excuse me. Vaccines are available to everybody. But this is a real opportunity to talk with either your board of directors or look around to your community and see what other incentives are available for your staff. The other thing you could think about, you could do something on the hazard pay side, or you could think about offering some flexibility. So, hey, if you're going to get a vaccine, let's do a vaccine event on Thursday and we're taking Friday off, right? So like there's other ways to incentivize folks, but the $50 per dose is specifically for people experiencing homelessness.
Thank you. The next question is from Heather, who asked, in order to provide vaccination incentives equitably, Is it allowable to provide the $50 per dose incentive to folks who got their vaccines prior to our beginning to offer the incentives?
Nah, you can't go back. It is going forward. So, but hey, this is a great way to engage and say, have you had your booster yet? And that way you could bring folks back in. But this is, you can't go back if they've already gotten it, because the whole point of the incentive is to get someone vaccinated. So if they've already been vaccinated, then they don't need the incentive.
Thank you. Maricela asked, when billing for street outreach for staff time, is an HMIS enrollment required for the people served? For example, PPE were purchased. What records are required if they're going to the volunteers?
So Marcella, thanks for your question. We've shared the HUD AAQ with you before, I know, and we're going to try and drop that in the chat again. The answer is exactly the same as what Chris said before, is that it's not a one-to-one for the PPE or for the volunteers, but it is a requirement for the Street Outreach Project to be an HMIS and to enter those engagements with unsheltered persons being served by that project.
Thank you, Heather. Another question from Deirdre asking, you're referring to ESG mini and yearly monitoring, not ESG-CV. Do we have an update on when ESG-CV monitoring notifications will be sent out?
By the end of this week.
Thank you. Shannon asked, can we use funds for street outreach that we originally applied for housing vouchers if we have a greater need for street outreach?
Can you repeat that question? I missed part of it.
Heather, I can get it if you want me to.
Oh yeah, go ahead.
Yeah, so I think what you need to look at in this situation is to talk to your grant administrator and see if it is possible to move some funds from rapid rehousing or homelessness prevention to street outreach. So if you can start the conversation there, we can probably move that forward as quick as possible. If you're unsure who your grant administrator is because you're not the direct grantee, please feel free to reach out. I'll put my email address in the chat box.
Thank you, Mackenzie. We have a question from Nicole who asked, if cash is provided for the $50 incentive, would a signed note from the client be an acceptable form of documentation for the RFF?
I'm assuming they mean, yeah, the proof that the person had the vaccine. Is that how you're reading that too, Ashley?
Yeah.
That would be fine.
Okay, thank you. And another question from Marcella. She asked, there is a mention that volunteer incentives were not allowed through ESG-CV. Can you expand on the why when it is allowed through CPD 2108?
Yeah, so let me make a little clarification there. People were asking if vaccine incentives, like that you could pay this specifically, the $50 per dose, for volunteers, and that the answer to that is the people have to be experiencing homelessness for the vaccine incentive specifically. You all have the ability to offer volunteer incentives, which is a reasonable amount of money to bring people in to be engaging in ESG-CV work. And I'm sure Chris may want to expand upon that, but I just wanted to make that clarification. I was specifically referencing the vaccine incentive piece. And that is connected to being people experiencing homelessness. Chris, would you add anything to what I was saying?
No, I would not.
Okay. So I hope that answers the question.
Thank you. The next question is from Amanda. Amanda asked, we are helping Project Roomkey clients. They each have an exit fund of $5,000 to use for housing needs. We are using the county funds, PRK, for furniture, storage, etc. We are having trouble getting them housing essentials such as blankets. Can our agency use our company card for ESG and get reimbursed through PRK funds?
I don't understand that question exactly, so I would ask that go to your grant administrator, or as Mackenzie said, go to Mackenzie if you're not a direct recipient of HCD, so we can understand that a little bit better.
All right, that was the end of the questions in the chat. We'll pause for a minute to see if there are any other questions. Okay, if there are no other questions, we will wrap up our time together. The recording and slides of this week's office hours will be emailed out. Please reach out to your ESG-CV grant administrator for further clarification on items shared during our time together. Or if related to ESG funds, please reach out via the email shown in this slide. Oh, next slide, please. And I want to thank our presenters for sharing with us today, and we look forward to seeing you all next week.